I'm State Representative Mary Flowers, and this is the Committee on Healthcare, Access and Availability. We're having a community town hall meeting in regards to the importance of healthcare here in the state of Illinois. And we're here today to hear testimonies from you, the people, in regards to House Bill 311. House Bill 311 would require health care for all Illinoisans. We're going to start off with Dr. Quinn Young. He's going to give a summary of House Bill 311.
Healthcare for All Illinois Act establishes a statewide single-payer health insurance plan which will provide health benefits to all Illinoisans equally and for all medically necessary needs. Those are very important concepts and embodied in no other proposal. The plan would save enough on paperwork and other administrative costs to cover all of the uninsured, of which there are 1.6 million in our state, and beyond that, an equal number with very poor insurance.
Mr. Edwards from ASME.
There's one plan to fix state's money mess: get workers to give back. Civic leaders, and I wish that was in inverted commas, say state needs to spend less on pension programs and health care for union workers. Now, who are these civic leaders? Try the Civic Committee of the Commercial Club of Chicago. Last time I checked, that included a retired CEO of McDonald's Corporation, the current CEO of the insurance giant Aon Corporation, and board members, if I remember rightly, included people from G.D. Searle, Baxter Travenol, Walgreens, and other mega profitable sections of the for-profit so-called healthcare, you might call it the sickness industry. This is a divide and conquer strategy. Leaders of these giant corporations, like McDonald's, which, as a former McDonald's employee, I can tell you pays absolutely no benefits of any kind to all of its worldwide restaurant workforce, they want to take away my healthcare and my children's healthcare, and your healthcare too if you have it, so that they can continue to justify their massive corporate irresponsibility to their own employees. Healthcare should be a right, not a privilege. No one chooses to get sick. The last thing, the least that society can do for the sick is to give them, and I do mean give, not sell, give them the health care that they need when they get sick. Thank you.
We've heard everybody talk about how much it's going to cost or not cost to finance, a universal health care policy. The reality is that a healthy population is a cheaper population to be able to manage. The money that we would save on the complications of the asthma and diabetes alone could finance the entire system. After reporting the third nursing home in about a 2-week period for what I perceived as questionable situations, culminating in a 90-year-old gentleman who was alert and lucid but had no family to advocate for him, no one to stick up for him, who came into the emergency room with a broken femur. The femur is the upper bone in your leg. It's really difficult to break this. And it had been bothering him for 2 weeks. Now, I'm not saying that they broke his leg, but I know damn well that he was complaining about it for 2 weeks, and somebody knew for 2 weeks that every time they got this poor guy out of bed that it hurt, and nobody did anything about it. So I called and reported and was, again, threatened with disciplinary action because, as the medical director said to me, don't you realize that these nursing homes bring in over $180,000 a month to the emergency room? You can't report them. They get angry. They'll stop sending their patients here.
Ladies and gentlemen, these are our tax dollars. If we could send a man to the moon, if we could build all these prisons, if we could have Olympics here in any one of these states in the United States, surely we could have something as simple as single-payer health care for all. Remember, everyone in and no one out. Thank you.